Hello everyone, you're welcome again to the Sameda channel, and the brief message this afternoon is about cervical cancer. Cervical cancer is the cancer of the mouth of the womb, which is the cervix, and it is a very common cancer, especially in this part of the world, and it's actually preventable. That's the message I have for you this evening, and it's so simple. All that is needed is just to put in some preventive measures and consider taking the cervical cancer vaccine. Ignorance is not an excuse when it comes to this one. A lot of data has been put out there in order to let all of us know, not just the women folk, that if screening for cervical cancer is not done, the risk that may have been there will not be detected. Now, there are some abnormal cells that may start to grow at a place in the cervix where we call the squamous-columnar junction. It's a place where the columnar epithelium and the squamous epithelium meet, and that's where the cancer usually starts from. So by doing pap smears, which involves taking cells from around that squamous-columnar junction and testing them to see if they are showing any level of abnormality, can be a great step in prevention of cervical cancer. Because if the cells that are seen are abnormal, then various tests are available to treat those levels, which may include doing a colposcopy and biopsy, could include doing a cone biopsy, or even doing some coagulation of those cells in order to stop them from going on to become full cancer. So we call them pre-malignant cells, can be detected by doing pap smears. But even before you even go to the issue of pap smear, there's still some basic methods of prevention, because we realize that people who smoke have a higher risk of having cervical cancer. We realize that those who have HPV infection, especially the high strain types, the ones that are more associated with cervical cancer. So if such HPV infection comes, then it's possible for those cells to become malignant later. Not 100%, but the risk is higher. So apart from the routine pap smears, also taking the cervical cancer vaccine to prevent infection by those HPV strains is also one way to prevent it. But I must tell you that even if you take the HPV vaccine, it is still required that you continue a 3-yearly cervical cancer screening test, which is a pap smear, if the ones you've done before are normal. But if they are abnormal and they need to do any of the intervention I mentioned, there may be need to do those pap smears more often. If a woman who has been having a regular sexual life before suddenly starts having bleeding after meeting sexually, it's also an indication to quickly go to the hospital and have the cervix checked out, because bleeding after sex is also one of the symptoms that have been associated with early onset cervical cancer. Some other simple things may also be checked when you get to the hospital. There might be need for urinary test, to take a swab of the vagina, etc. But the message in short today is that early detection and treatment of premalignant cells of the cervix can prevent cervical cancer. Getting the cervical cancer vaccine can also reduce the risk of developing cervical cancer, because once the cancer has started, then more intense treatment may be needed, which could have been prevented. Thank you very much.